Hey guys, video number 2 of today. So in this video, I'm going to be talking about how to use the ophthalmoscope. So typically we can use this tool to assess any injuries or abnormalities with the patient or athlete's eye. So to start off the assessment, we want to inspect and palpate the patient's eye. Palpating, you want to make sure you're wearing gloves, and you want to do this if necessary. You can palpate around the eye also for any point tenderness, anything along those lines, anything abnormal if you feel crepitus at the supra infraorbital borders, anything like that. So you'd inspect for any edema, ecchymosis, any obvious deformity, like abrasions, lacerations, anything along those lines. So then we would move on to having them look at the Snellen eye chart. We'd have them read off of it. So have them stand away from the chart. You'd have them cover one eye, read with the other, and then switch, assess that. And then we would move on to using the ophthalmoscope. So say the patient is wearing glasses, we'd ask them to remove them. If they're wearing contacts, that's fine to leave in. So the first thing after that, we want to dim the lights in the room that we're in, just because we want to have a clear picture of what we're looking at and everything. Make sure you have the patient fixate on one thing. I know when we practice using the ophthalmoscope, a lot of us focus on the clock. You can have them focus on something like that. Anything in the room that's just easy for them to just look at while we're doing this assessment with the ophthalmoscope. Once they're fixated on something and the lights are dimmed, that's when we get into position. So say I'm assessing the patient's right eye, I would have the ophthalmoscope in my right hand and my left hand placed on the patient's shoulder. If I was assessing their left eye, it would be flip-flopped, ophthalmoscope in my left hand, my right hand on the patient's right shoulder. So just depends on what eye you're looking at. Obviously you want to test bilaterally too. So once I get into position, I want to make sure I have the lens at 0. I can adjust as needed just to get a clearer picture. Once I'm in position, I can start moving at a diagonal angle. So I want to move from the middle to like the outside almost. So I'm like moving on a diagonal angle towards the right eye until I hit the patient's red reflex in their right eye. Then once I hit the red reflex, I can start moving in towards the patient until I'm about 1 inch away from their eye. So once I'm there, I can start looking in their eye, assessing their eye, looking for anything abnormal, any lacerations, abrasions, any like infection that I can see, any blood pooling. One thing I can look for is corneal abrasions, detached retinas, anything like that. You can look at the optic nerve if you look close enough, and then any of like the veins and everything you can look at just to see if there's anything abnormal or if everything is okay and stuff like that. You can adjust the light on it. I know one of them is the cobalt blue one, which helps you to look at corneal abrasions. I know there's different ones. And yeah, I know in some situations you can use dye just to see any abrasions or anything clearer. And like I said before, you want to test bilaterally, and that's how you use the ophthalmoscope.